does it actually become something where the insurers are saying, I'm not going to pay you unless you're using these AI tools?
I don't know if you have heard anything, to this effect, but is there any concern that some insurance will cover, say, right now we have issues with different modalities of imaging, right? Like, oh, we'll do this or not this. We'll do proton therapy. We want MRI, PET, CT, blah, 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 blah. Hopefully there's not going to be this whole new concept of, if there's any price difference for an AI technology or an AI augmentation, then we will or won't. And because the data doesn't support it, for example, all of a sudden now it's a whole new kind of slowing down or bottleneck that I didn't even think about. But at the same time, we know that the AI part of it has a cost. So like if it is a different cost, there's, probably justification. So that's now another one that I just thought of.
I haven't thought about that. I will say, like, right now, and I think this will be a question that has to be answered, right? So right now, the cost of AI, for the most part, especially on the point of care side, like the cost of AI is not falling to the insurer, right? So like, I don't think they're going to care whether, AI was used or not. If there becomes technology that is directly like billable, like if that becomes like a billable service or thing that you do and the insurance has to pay for it, yeah, you better bet that they're going to be wanting, prior authorization for whether or not you used AI to augment your care in some capacity. And that is a very kind of scary world, but we do have to start to think about like how is this going to ultimately be paid for, right? Because I think that what we're seeing right now is that it's, there's going to be recurring questions about like the ROI of these tools and where does the cost end up, coming out, right? Is that incurred at the part of the practice because it's, it helps so much with efficiencies and, it makes your clinicians happier and better and it improves quality, so that they're going to pick up the price tag on that. I also think like there's a world that I see kind of on the inverse where if AI becomes such an obvious value driver for the patient. So if we can show, and I guarantee there's studies being developed on this, we can show that there's improved quality, improves, XYZ, good, robust quality studies that show that AI for clinical decision support for whatever improves patient outcomes. Then it becomes a question of does that start to get bundled into like value-based care models? And does it actually become something where the insurers are saying, I'm not going to pay you unless you're using these AI tools? I actually think that could be more likely where it becomes such a value driver. They're like, no, you need to make sure you're using these things. And we've seen that with, these certain like decision support tools kind of making their way into value-based care programs. But I could see that being something where if we can show the benefit, if we can show the outsized benefit, then they're really going to like want you to be doing that because it's improving outcomes, improving efficiency, improving kind of quality across the board. So that'll be really
I love that. I love that. And we touched on that just in the previous interview, actually, where I was like, is an AI augmented world with enhanced, prognostics and comparing it to real world data and longitudinal and likelihood of outcome, even if it deviates to some degree, or at least directs between two otherwise equal standard care options. Is that what today's value-based care model is? Like, is that actually just a replacement, hopefully, of what the healthcare system is in its entirety? So that's a very interesting point.